Men think, oh, okay, I won't smoke in front of the wife, I'll not smoke in the car, I won't smoke in the bedroom. But it's not the passive smoking. It's the effect of the smoking on the sperm DNA. That sperm DNA damage will then cause a miscarriage in the wife. Now, if a woman has not got pregnant till 40 and then gets pregnant with IVF at 40, it's not IVF which causes the abnormalities. She would have had the same problem if she would have conceived naturally.
Correct.
So now this is once again brings us back again and again to female age. That female age is the most important thing. And this is the biggest red flag message for everybody out there. The minute the female partner crosses the age of 30, the incidence of infertility is 46%. That means every second girl who crosses 30 and is still not had a child is likely to need fertility help. Everywhere patients love these new things which come in. Like it was laser. Oh, you must really this doctor, he replaces the joint with laser, or he treats a cataract with laser, or he does IVF with a laser. So it's very impressive, right? Patient doesn't even know what the laser is.
Right.
So AI is creating the same hype now.
Welcome to Perception and Beyond, your go-to podcast for powerful conversations that decode identity, purpose, and perception. Today, we are diving deep into the world of IVF, a topic surrounded by fertility myths, social stigmas, emotional challenges, and growing medical advancements. Joining us is one of India's leading fertility experts, Dr. Jatin Shah, an authority on IVF success, egg freezing, male infertility, surrogacy, and everything in between. Whether you're exploring IVF for the first time, curious about fertility treatments, or want to understand the truth behind assisted reproductive technologies, this episode will give you expert insights, facts, and hope. Let's bust some myths and unlock what modern science truly offers to couples and individuals dreaming of parenthood. Hi, Dr. Shah. Welcome to Perception and Beyond.
Hello.
So, I want to know that people often believe that IVF is considered as a last resort. सब कुछ नहीं होता है तो फिर IVF के लिए लोग आते हैं. So, according to you, do you think that they should come before? Is it supposed to be an early intervention, or you think that सब कुछ try करने के बाद people should come for IVF?
Yeah, thank you so much, Suman, for having me on this wonderful and prestigious
Pleasure.
podcast. It's indeed a pleasure to be here today. And like you correctly said, there was a myth that IVF should be, the last resort for any infertile couple. But this was probably true about 2 or 3 decades ago when IVF first came in, just for patients with blocked fallopian tubes.
Right.
And also the success rates in those times were just 5%, 10%. So it was not really great. But about 15-20 years ago, we realized that there are a lot of other indications. Like nowadays, you see so many women with endometriosis, polycystic ovarian disease. You have so many couples where the male partner has a sperm issue. So we realized that IVF is finally a mode for treating all of these indications. So generally today now, IVF is not considered a last resort, but rather a first resort for a lot of patients like those, of course, with blocked tubes, moderate to severe endometriosis, severe PCOS, polycystic ovaries, or unexplained infertility. There is one category where everything comes back normal. All the tests are normal, everything is fine. And gynecologists often tell the couple, don't worry, you don't have any issue, just keep trying and it will happen. So these are the danger cases, where actually there are hidden problems which science hasn't been able to diagnose.
Correct.
So unexplained infertility and male infertility, which almost constitutes a huge proportion of the patients. So nowadays IVF is considered practically as first resort for a lot of patients, especially if, say, the woman has crossed 32, 33 years of age.
So according to you, is there a time span for which they should wait and then decide that ab IVF karna hai, or there are probably certain red flags that they should keep in mind and then decide that now this is the only way we have to go, and then we should go to the IVF specialist?
Yeah, so that's a very good question. So the only two main important things for prognosticating, what are the chances of this couple, is the female age is the number one. However much science advances, we cannot reverse female age. And number two is the egg reserve. We have a test called AMH, which tells us that what is the time on hand and what is her egg reserve which is remaining. Now, if she is 28 years old with a very good egg reserve And if she's just married for a year or two, and if we go into some details and they say, oh, we are not having intercourse frequently, husband keeps traveling, nowadays that's so common. So we are missing the ovulation times. So then maybe we would tell them, okay, try 3 months, properly, naturally with the ovulation monitoring and all those things. If that doesn't work, we may recommend, say, a couple or 3 cycles of IUI, that is intrauterine insemination, where we just track the ovulation of the wife. And when she ovulates, we take the husband's sperm, wash it in the lab, and put it directly into the uterine cavity.
Okay.
So this could be done for, say, 2 or 3 months. So 6 months of, say, natural trying, IUI trying. And if that doesn't work, then we would go for IVF. Like 25 years ago, we used to tell them do 12 months of IUI because we were not confident of IVF also.
True.
But now that, IUI success rate is still at 10%, IVF we are now at 50 to 60% for young couples. Why would someone want to keep wasting time?
Plus, I think everything also advances over a period of time. So IVF process is also advanced, and we are able to see very evident results also at the same time.
Yeah, I don't know if you saw the movie Joy on Netflix, which traces back how IVF actually started. If you see the movie, I think it was the 267th woman who got pregnant. Means they failed so many times before they got the world's first IVF baby. So even when I started in my first year, I did only 9 patients, and the 9th one got pregnant. So, success rates were so low. Today, now it's a daily thing. Like every day there are 10 results, 5 are pregnant, 4 are pregnant, 6 are pregnant. I have had only one day in 35 years where 10 out of 10 have been pregnant.
Wow.
They has never come back. But of course, that's not statistics. Overall, on an average, 40% is what we expect if you put all age groups together. So it's very, very successful now. So it definitely should be an earlier resort than any other treatment.
Correct. And the myth that everybody follows or believes is that IVF is largely for older women.
Yeah.
And younger women में IVF की ज़रूरत नहीं है because that तो is a natural process. Try करो बच्चा हो जाएगा. But the young woman also eventually turns to be, waiting for so many years and then nothing is happening. And then the final last resort that they think about is IVF. So what is the time, or rather, is this like a myth or a fact that IVF should be considered by only younger or older couples, according to you?
Yeah, so this follows up on your previous question about, whether it should be a first resort or not. So obviously when success rates were not good and it was considered a last resort, most of the women coming for IVF were 38, 40, means they've tried enough, everything done, dusted, sorted, everything has failed. Then they would turn up in an IVF center. So those days were different.
Correct.
Now it is commonplace, every building in Bombay probably has IVF babies. You go to a mall, you see so many twin prams. How come there are so many twins being showered everywhere?
Right.
So obviously IVF has become so commonplace now, and even young couples know because they have a friend or a neighbor or a relative who did IVF and got a pregnancy. So it's all become very easy now. So now we see more and more young women coming and opting for IVF. And the classic example is that we have such young girls now who are not even married and they're coming forward for egg freezing.
Correct.
So there is so much awareness about this entire field,
Absolutely. And then when you spoke about twin babies, so is it always that IVF process results in having twins or triplets?
No, because what we do, for those who don't know what IVF is, we generally stimulate the ovaries of the woman to not get one egg, but like nature gives you just one egg a month, but we want 5, 10, 15, 20, as many eggs as possible. Then we retrieve those eggs, fertilize them with the husband's sperm, create embryos, and then we put back 1 or 2 embryos and we freeze the rest. Now, until about 2018-19, we used to commonly put 2 almost for everybody and even 3 for some patients. And there were clinics which were even putting 4 embryos. So, there was a year like we used to have 40-50% of them being multiple pregnancies. So if you have 1,000 pregnancies a year, there are 500 twins and triplets.
Correct.
Then during the pandemic, we realized that we don't want these triplets and we want less of twins because we don't want them to keep getting admitted to hospitals for complications. Don't want them to be exposed to COVID, hospital visits. So then there were international guidelines that don't transfer more than 2 for any patient. So we brought down to 2 thinking that the success rate will fall. But fortunately, the success rate didn't fall. We eliminated triplets and anything more than that. And twins also dropped from 50% to just about 10-15%.
Oh.
So now we are in a very good balance because, people love twins, patients love twins. It's the only field in medicine where the patient loves the side effect. Otherwise, nobody likes side effects and nobody likes complications.
Right.
But we consider it a complication because there are a lot of premature deliveries. Then one might be big, one might be small. They're bringing up 2 children together in today's world is not the easiest thing to do.
Yeah.
So there are a lot of downsides, and I think in another 4-5 years we may come down to just putting one embryo for all patients, so that we ensure just a single baby, you know, and no twins also.
Absolutely. So, how emotionally traumatic is the IVF procedure for a lady who's involved in the whole process?
Uh, Actually, if you divide it as physical and emotional, physical part has become relatively simple over the years. You know, when I was doing it 30 years ago, there were much more injections. There were a lot of painful, oily injections. A lot of clinics used to give complete bed rest after embryo transfer of 15 days. There used to be daily visits for blood tests, ultrasound, and all that. Now, today, we are in an era where it has become so simple that a woman has just 3 or 4 visits in the entire first month. Most of the injections are with pen devices, so they are all easy, self-administered, easy to do. The needles are so small they can't even see them. So the physical pain part is almost gone now totally from IVF. And even the egg pickup is done under a very short sedation or anesthesia. So the woman doesn't feel a thing. But the emotional roller coaster is what kills. Because, you know, as I just told you earlier, even if you Google Europe success rates of IVF for 2023 for self eggs with their own eggs, they are at 30%. At our clinic for the last 15 years, we have been steady at 40 to 45%. I'm not saying I'm better than the European doctors, but our patients are 4 or 5 years younger than European patients, which again shows how important female age is. That the younger the woman, the higher the success rate. So, you know, this, if they are going to deal with a 40% success rate, it means that 60% are going to fail.
Correct.
Which is where the emotional quotient is very high. Because, you know, the hopes go up, and it's not only one person involved. See, in any other field of medicine, a doctor is treating one individual. You can't treat 2 people or 5 people or 10 people. In infertility, it's 2, the husband and wife, and both families. So everybody is involved. So if it fails, there's huge emotional, you know, it's catastrophic. Everybody is in down into depression for, you know, 1 week, 2 weeks, 3 weeks. Some take 3 months, 6 months to recover. Some don't ever want to enter an IVF clinic again. So this is where counseling is very important. So
in fact, I was coming to that do you also have to sit these people down and counsel them?
Yes. So this I learned the hard way. Initially, it was only me who was the counselor, the embryologist, the clinician, everything 30 years ago.
Yes.
Now we have a team of 25 people. So it's, of course, in the new laws, it is mandatory now to have a counselor. But we have 3 counselors. And we have myself and 2 junior doctors who are also very well versed with counseling. And now there's a European study which shows that the best clinics are those where the dropout rate is the lowest. See, we know that a patient has to do multiple cycles. But if in the first cycle she's so traumatized that she just won't come back to you, you've lost the chance to make her pregnant, right? So if there is good counseling, good backup, somebody has to be available when she wants to cry, when she wants to laugh. If there is a shoulder, you know, which is always available, the patient always comes back. And when she finishes her 3 to 5 cycles, that is the time 9 out of 10 will get their babies. So this whole journey, you know, we tell all patients on day 1 that be prepared for a 1-year journey. Don't expect more than 40% per cycle. And it might take time. We'll try to keep it as easy as possible, less taxing. Just 4 visits, no daily blood tests, no daily scans, no bed rest at all, no painful oily injections. So all this has changed over the past, I think, 8 to 10 years. So it's become so simple now, which again brings us to the point that why shouldn't it be the first resort? In fact, you know, in Europe, I think about 35, anyone married for or trying for a year, it is straight IVF.
Mm-hmm. You are a very known name in the IVF, field.
Yeah.
So I want to know that usually a particular patient on an average will have to do how many IVF cycles to actually have a successful process where the lady conceives.
Yeah, so this is where counseling is again very important. We cannot give one success rate to every couple. Now suppose it's a 40-year-old woman who comes, say, with a very low egg reserve and she's already failed 3 IVF somewhere. Obviously, I'm going to tell her that your chance of success per cycle is only 5 to 10%.
Right.
And if I have a 28-year-old who is married 1 year with all reports being very good, I'm going to tell her 60 to 70% chance. So that counseling has to be very accurate. You cannot fake figures. You cannot tell the 40-year-old that, oh, you'll have a 70% chance of pregnancy. Otherwise, it's very disheartening. Nowadays, everybody goes on Google. The minute she checks, she's going to read it's 5 to 10%, right? So realistic and genuine counseling is very, very important for each and every patient in an IVF clinic. And that is the key to getting success in these patients. So if you're realistic in giving them hopes, then they also know how to carry it forward with you.
Also, Doc, what is the role of stress in the whole process? Because when you go through a cycle, if it doesn't succeed and then you are too stressed out with the whole thing because there's anxiety, there is stress, does that also impact the IVF process, the success rate of the IVF process?
Yeah, it definitely does. Of course, by stress we mean intense emotional stress.
Yes.
And a very simple and nice example of knowing this part is very often you hear that the couple has not conceived for 14 years of marriage, and then they say do get an IVF pregnancy and they deliver a child. Very often she gets pregnant within a year of the first child naturally. So what changed? What changed? So it was that 14 years of stress which was probably affecting her egg quality and everything. And the same story I've heard for so many adopting couples. You also might have heard the first child was adopted after 8 years and the next year she got pregnant naturally. So there's no other explanation. It's only the stress which went away. But at the same time, on the other hand, you see India's population,
Right.
with all the stress that people have. They don't have food to eat. One child on the back, one in the tummy, bending in the fields, working. We can't even imagine that kind of stress, and still reproduction continues.
Correct.
So, of course, everything is nothing 100% or 0% we have to, but stress is important because it indirectly might take a toll on the entire treatment cycle.
Correct.
Yeah.
And also, I don't know if it is a perception or it is a fact that usually the IVF babies, people feel or believe that they are weaker as compared to the normal regular babies which are born.
Yeah.
So how real is this situation?
No, so again, it's a total myth because I told you initially all the women who came were all 35 plus. Correct? Now you know that after 35, let's leave IVF apart. Even if a woman conceives naturally, she has a lower chance of pregnancy per month. She has a higher risk of miscarriage because of genetic abnormalities in the fetus. She has a higher risk of Down syndrome, Mongol babies with mental retardation, and a lot of other anomalies which are associated with maternal age. Now, if a woman has not got pregnant till 40 and then gets pregnant with IVF at 40, it's not IVF which causes the abnormalities. She would have had the same problem if she would have conceived naturally.
Correct.
So now this is once again brings us back again and again to female age. That female age is the most important thing. So if you see 100 of my IVF pregnancies in the under 35 age group, you'll probably find one with a minor abnormality, which is the same as in nature. But if you take a 40-year-old, again, if it is 10%, it is the same as nature. Even in nature, 10% will have abnormalities. So it has nothing to do with the IVF technology at all. It is only related purely to the age of the egg and the age of the woman at which the IVF was carried out.
Which means that the age is a very crucial factor when it comes to IVF, especially for a woman.
Yes.
So a man's age is not considered for this entire IVF process?
Luckily, now we have new laws. So we cannot treat a woman once she crosses 50. And we cannot treat a man if he crosses 55. Until now, everyone thought that men have no issues. Even at 80, he can be a father. 70, he can be a father. So in Europe, it's very common for the husband, second wife, whatever, and the husband is 45 or 50 or 60 or 65. So until now, it was thought that nothing happens. But there are few studies, nothing to alarm the audience or anything, but there are some studies where they have been connecting, like suppose the teenagers have a lot of, say, bipolar disorder or manic depression, anxiety depression, and they don't know the reason. It could be related to the paternal age at conception.
Oh.
So if the man, say, was 55, maybe the child is a little more prone. When he grows up, you won't know at birth. Only when the child becomes a teen, you might find out that, okay, he's a little depression or whatever it is. So there are studies done in Sweden, Finland, Denmark, all the countries where this is a common issue, where the fathers are often of advanced age. So as of now, we have just 4 or 5 publications, but they are really alarming. It's just a word of caution. See, again, you have to see statistics. It's not that every child of a father who is 55 is going to have a problem. But say if a 35-year-old, the incidence of anxiety depression in a teen child is, say, 3%, it might become 6%. Okay, so we are not saying it's going to be 100%. So that wrong message should not go to the audience. Absolutely. But everything paternal age will be connected to some problems in the long run. We don't know. Like now just to divert a bit, there's an interesting correlation. A lot of girls come to us for egg freezing. And many times their egg reserves are very low. Like we'll have a 24-year-old and she said, I did my checkup and my AMHS comes 0.8. How can it be? I didn't do anything wrong. I exercise 6 hours a day. I'm a vegan and I don't eat anything. And so they are very shocked that how come the egg reserve is low. So now there's a study to show that if the grandmother ate a low protein diet during pregnancy, the granddaughter will be born with less eggs.
Oh my God.
So now this is proven. And that effect lasts for 2 generations.
Wow.
So daughter and granddaughter both.
So blame the grandmother who did not have enough protein.
You see in India, how much protein do women really take
Correct.
during pregnancy, right? In vegetarian, we know that you have to eat too much of paneer, soya, tofu to get that much protein, which is enough.
Absolutely.
So we have to be conscious of all this. Of course, nowadays in pregnancy, the gynecologists always advise have a high protein diet. Even if you are vegetarian, these are all the options, sources. So that's very important to follow so that your next and next of kin are born with a healthy egg reserve.
Correct.
Yeah.
Now, talking about surrogacy, although the norms have changed drastically over a period of last couple of years, but why is there a social stigma around a surrogate baby? Because it's eventually your eggs
Yeah.
which are going in someone else's body. So people even then still have this reservation that ये गलत चीज़ है, इसको नहीं करना चाहिए क्योंकि अपना बच्चा तो अपने ही पेट के अंदर होना चाहिए. Although they are not able to conceive, but then also they have this kind of mindset.
Yeah.
So how do you break this kind of...
Yeah, so again, it's been a paradigm social shift, like 15, 20, 30 years ago, IVF itself was a stigma. Then to take a donor egg or a donor sperm was a bigger stigma.
Correct.
But now IVF you can hide from the world. A donor egg and donor sperm you can hide from the world. Surrogacy you cannot hide. So until 15 years ago, I had a lot of communities, patients, different communities would tell me, IVF chalega, donor egg chalega, donor sperm chalega, but surrogacy hum nahi karenge. Because they don't want the world to find out that they did any of these treatments. So till then, you were correct that there was stigma around the surrogacy part. But after that, I think there were a lot of surrogacies all over the world, Hollywood, Bollywood, in India also we had so many. So I think somewhere something opened up and society became more liberal. And then we had single fathers, we had single mothers, the whole bold new generation. So I think the stigma has reduced a lot now in almost all the communities that I've been treating. So I don't see the same thing what I used to see 10, 15 years ago, when there was a real major stigma. Even with IVF itself, like, we have a notice board in all IVF clinics, and we have these screens where all happy patients' photos are there with their children, telling their story in brief.
Right.
So 20 years ago, the patient would click a photo with me and say, Doc, we have not told anybody, don't put my photo on your display.
Arey.
So there would be more photos in my drawer than outside on the display.
Oh my God.
Right? But today, it's the reverse. Today they click a photo with me, Doc, please make sure you put it outside on the display. So you can see this is the whole thing which has changed. So proudly they like to tell people that yes, we did IVF, there's nothing wrong with it. And we are so happy and we have 2 children. And so 90% now, the stigma is almost totally gone.
So, Doc, I want to understand, a lot of people assume that IVF is only for the rich and celebrities. To what extent a common man can have the accessibility of undergoing IVF process?
Yeah, I think that's again one more myth associated with IVF because, when we started 30 years ago, 32 years ago to be accurate, I was maybe the 7th clinic in Mumbai and in the first 20 of India. So obviously it was very limited availability to everybody. It was not that expensive even in those days, but there were not enough clinics to cater to our population. So then gradually clinics started mushrooming. And if I was the 7th, 8th in Mumbai at that time, today you won't believe, there are almost 300 IVF clinics in Mumbai, Thane.
Mm-hmm.
So you can imagine the number of clinics that we have. It's almost like gully mein there is an IVF center, right? So obviously everybody has access to IVF. And the cost compared to the West is nothing. If you see in Europe, the average cost of a cycle is 12 to 15 lakhs.
Oh.
In the US, it is 15 to 20 lakhs.
Okay.
Only NHS, UK, it's funded, but they can do only one per year. So every country, it's exorbitantly expensive. Compared to all of them, we use the same drugs, the same disposables, the same equipment, the same media, like any lab in Europe or US. And our cost is almost 1/7 or 1/8 of the cost in Europe or US.
So, which means on an average, if somebody has to go for the IVF procedure, what is the cost that we can roughly?
It varies from 2 to 3.5, 4 lakhs as per the requirements of the couple, the number of injections that they will need, a lot of other factors. But there's always hope for everybody because I'm sure most of the good clinics will always try to help people who have not very good means. So generally doctors on the whole, doctors never have fixed charges, I'm sure. When you go to a hospital, okay, this class, this class,
Yes.
this class. So same way in IVF also, we try to help everybody as much as we can. And
Correct.
then, there are clinics where, okay, we'll not charge the police, we'll not charge railways, we'll not charge army, defense, navy. So everybody finally has access to IVF facilities. So, and of course, for the population, we still don't have enough IVF centers, which is why, every clinic which comes is generally successful if they have some success. Success rates may not be the best, but you don't generally hear of an IVF clinic shutting down.
Correct.
Now you have these corporate chains, you're hearing of IPOs, all kinds of things happening. So obviously we still haven't saturated the need of the country, but awareness is there in every village. Every village, everybody knows what is IVF, where it is to be done, how much it costs, what is the success rate. Awareness is huge now, huge.
And I don't think that IVF is needed only by people who are right there. My office boy just last week came to me and said that, the fertility count of the egg count of my wife has reduced drastically. And I think now the doctor has recommended that we have to go through IVF process.
Yeah, correct.
So, I think every second
See,
person
even
today,
he's aware that, okay,
every second person
because
today,
even if they go to, say, a municipal hospital, government hospital, the OPD, the gynec will tell them that now your case we cannot treat and you please go to an IVF center.
correct, absolutely.
That's very important.
Also, Doc, there's a, I don't know, myth or fact, but usually when we talk about IVF, we always have this thing in mind that it is because the egg count of a woman is less. इसीलिए IVF कराना है. So is it always the fertility issue of a woman because of which there could be an issue between the couples that they are not able to have children, or it could also be with the men as well?
No, not at all. So we need to understand some statistics. When I started 30 years ago, the incidence of infertility was 1 in 16 couples.
Oh, acha.
Because 30 years ago, like I married at 22, my wife was 18. This was still happening. Right? We had our first child when she was 20 and I was 23 or whatever, right? So things were still happening at a very young age.
Correct.
When last 15 years ago, when the WHO came out with new statistics, it went up from 1 in 16 to 1 in 6. So on the whole, all over the world, infertility increased from 1 in 16 couples to 1 in 6 couples. Then we had a study in all our metropolitan cities, Mumbai, Kolkata, Chennai, Bangalore, all the big cities. And they found that the minute, and this is the biggest red flag message for everybody out there, the minute the female partner crosses the age of 30, the incidence of infertility is 46%. That means every second girl who crosses 30 and is still not had a child is likely to need fertility help. Now, this is a very scary statistic because you can put on one side all your diabetes, tuberculosis, blood pressure, sugars, everybody together, and you have more infertile couples than you have those patients.
Right.
So that is why again and again we keep saying that female age is the most important thing. But to address the other issue that just because her egg count is low, to rush into IVF is not true. There must be so many women in the general population who have got pregnant despite a low AMH, but will never have access to those statistics, right? Everybody doesn't check their egg count. So you have so many maybe 38-year-olds, 40-year-olds with very low counts because finally it takes only one egg to get a baby, right? So it's not that, count is low. She's not menopausal. So she's still producing an egg a month. But it is a red flag that not to waste too much time with doing other things. So you don't want to do 1 year of naturopathy, then 1 year of Ayurvedic, then 1 year of homeopathic, then 1 year of a gynec, then 6 months of IUI. Then you are playing with fire. Because then it's likely that if your egg count was already low, then you will go very, very low. And then you might even fail IVF and end up with an egg donation, which you don't want. You want your own biological offspring.
Correct.
So that is the two messages. That one is that every low count doesn't mean that IVF is required. But it shows a bit of an emergency that she should try and become a mother fast or freeze her eggs for the future. If she's interested in a career or she's not found a partner or she's not financially stable, freeze your eggs, get stable, but at least you have preserved your fertility for the future. So these are the two aspects to it. Low AMH doesn't mean rush into IVF, but at the same time, you have to be aware and conscious that your time on hand is limited now.
So how common is male infertility?
Yeah, male infertility is the main, everybody thought that male is generally not responsible. It may be 10%, 20%. The truth is 50%.
Oh,
so
okay.
Yeah, so if I get 10 couples, almost 5, there will be some form of a male factor. So there will be 20-30% of couples who will have dual factors. So there will be a female factor also and a combined male factor.
That also happens?
Yeah, very common. 20-30% of patients, there will be both partners will have an issue. So all those days are gone of blaming the woman or blaming the man. Now we know it's a couple unit and they are equally responsible. 50% means half the cases are male, half the cases may be female. 20-30% of those 10 may have both. So it's all very, very common now. But the thing is, male factor, we got a new technique in 1992 called ICSI, that is intracytoplasmic sperm injection.
Okay.
Because, finally to make one baby, you need only one sperm. right? Now, for a natural pregnancy, you need 20 million, you need 60% fast motility. For an IUI, maybe you need 10 million with 30% motility. But for an IVF ICSI baby, you need only one sperm. So even men with the lowest of sperm counts, poorest of sperm motility, as long as they give us one good healthy sperm, I just have to pick it up, inject it into the wife's egg in the lab, however weak it is, because the egg has a very hard shell. So only if the sperm comes like a bullet, it can break the shell. So we do that with the needle, inject it in, and they get their own biological offspring. So although male infertility is so common, a lot of it, 80-90%, was conquered in 1992 with the advent of ICSI. But nothing like that has come for reversing female age and eggs. So now that is where, although male infertility is so much, we don't give it that much attention because we have ICSI.
Correct. So is lifestyle factor or factors contributing to the whole stress and the infertility issue amongst men and women?
Yeah, definitely, because see, a lot of this age group where their wife has crossed 30, and especially in major cities, the corporate world, running around, eating out 4 or 5 times a day, maybe lunch is out, dinner is out, everything junk food is one thing. Male obesity is on the rise, male diabetes, blood pressure.
Both, I would say female also.
Female also.
Yeah.
Smoking in male and female both, partying too much, binging on a Saturday night, shots, 6, 7, then recreational drugs, whatever, is going on. Then people think, oh, cigarettes are not safe, so let me do vaping or e-cigarettes, which are worse. Cigarette research is there for more than 100 years. I just read an article that the liquid which is used in vaping or e-cigarettes has 88 chemicals. Who's going to do the research on those 88 chemicals affecting fertility and the babies? So-called safer options are not actually safe. Nobody might smell you, and you maybe can do it in the office and nobody will find out that you had a smoke. Maybe that's the only advantage, but otherwise I think it's more dangerous, which is why the Indian government correctly banned it, right? Because we don't have any research on it.
Yeah, because I think पुराने ज़माने में लोगों के 8-8, 9-9, 10-10 बच्चे होते थे, where they were like in abundance. Today, to have one single child, it's so much of a struggle for people because of the way they live, the way they eat. I think everything because of Zomato, Swiggy, and all other
Correct.
deliveries that have started. I think overall, that organic wave, how we used to live earlier, when we were younger and, our parents used to live, I think that kind of lifestyle has completely gone out of the window. So
You're
maybe
seeing too much obesity.
Correct.
You're seeing obesity in the corporate world,
Absolutely. And also the culture of having so many people in the house who will do things for you. You will not even move in the house. So that also adds up to that obesity factor, plus the kind of food that we eat. Although some people have become extremely conscious about the diet, but there is also a flip side to it, that there are so many people who still don't bother about it.
Youngsters are usually generally careless because they're so much into their careers. They hardly give a thought to what did they really have,
True.
for lunch.
Plus following the rat race, following the corporate culture where there is so much of insecurity, anxiety, stress.
Yes. And smoking in the female is known to cause defects in the egg, genetic defects in the child, a lot of things, even before pregnancy.
All put together, I think all these things take a toll on.
Even men think, oh, okay, I won't smoke in front of the wife, I'll not smoke in the car, I won't smoke in the bedroom. But it's not the passive smoking. It's the effect of the smoking on the sperm DNA. That sperm DNA damage will then cause a miscarriage in the wife.
Oh.
So actually it's not the wife who caused the miscarriage, but it's the smoking of the male which caused the miscarriage. So all these new things have been coming in the last 5 years.
True. So what are the factors that affect the IVF success, if I may ask you?
Yeah, so the 3 key factors are: one is egg quality, which is related to female age and the general health of the female oocyte, whether she has polycystic ovary, endometriosis, lot of other things. The quality of the male sperm, again the DNA fragmentation in the percentage of good DNA. And the third is the uterus, of course. So it's the seed and the soil. Both the seeds have to be perfect and the soil has to be good. So the soil, the endometrium, has to be perfectly developed, should have very good blood supply, no damage with chronic infections, endometritis, tuberculosis, all those, which are very common in India. So if these 3 factors are good, then you have a very high chance of success in the first or second attempt. But a lot of failures are because 1 or 2 or all 3 components are not optimal.
Correct. And does the success factor also depend on the doctor? the expertise of the doctor or the experience of the doctor?
Yes, it definitely does, because IVF 30 years ago was totally different from what it is now. We have a lot of clinics mushrooming all over the city and the country. Success rates do vary from clinic to clinic, although everybody does have some form of success. But now especially clinic like ours, we have become now tertiary units. Like today morning, I had a patient from Andheri, from here only. And she said, we had heard your name from 2, 3 people. But then we said, no, the logistics of going right all the way to Govala Tank is too far. So we did a cycle nearby, then a second cycle nearby. Then we said, no, now 2 times it's failed, now we should travel there. So, there are a lot of such factors where these things also play, distance, logistics, and all those things. So there is a difference in success rates, because now the time is totally of individualization. You can't have one protocol to treat all patients. So every patient has to be customized, individualized. No 2 files should be the same. In a good IVF center with a good doctor, you will have so much of attention being paid to each patient.
Absolutely, absolutely. A lot of young women, like you also mentioned earlier, are, especially when they have a delayed marriage or they are delaying their marriage plans, they decide to freeze their eggs, like we just discussed. So, what is the process for egg freezing, and who are the right people who can come for egg freezing to you?
Yeah, that's a very good question, because 7 years ago when I started this, egg freezing became popular everywhere. I just did 3 or 4 egg freezings in the entire year. And today, without exaggeration, it's almost 1 a day.
Wow.
So if you like yesterday, I did 3 in 1 day. So that many girls are now coming forward to freeze their eggs, and rightfully so, because we know the American guidelines now are very clear that the best success rate of frozen eggs is if you freeze it between 28 and 32. So initially 7, 8 years ago, we used to get 40, 38, because they just heard about it. They panicked and they came and froze their eggs, right? Gradually, the age group has been coming down. Now we even have 22, 23-year-old college girls about to go abroad for education, just coming and freezing their eggs, because they know that childbearing is going to be a distant dream, maybe 5 years, 10 years down the line. So the first most important message is that it should be done between 28 and 32. The earlier you do, the better the results. And why? Just for example, say you have a 30-year-old. So she needs 8 eggs for a 70% guarantee that she will have one baby. At the same time, a 40-year-old needs 42 eggs to have a 70% chance of.
Oh my God.
And at 42, she will need 80 eggs, 80 eggs, to be assured of a 70% chance of an IVF baby. Now at 42, how will I get 80 eggs? It's just not possible. Already the reserve is down. With the highest of stimulation, she'll give me 2, 3 eggs. So that's why the live birth rate at 42 becomes less than 3%. And for a 30-year-old, it's 60%.
Correct.
So this is why it's very important that freezing should be done at the right age. Coming to the process is relatively simple. Usually there are injections from the second day of the periods, which go for about 8 to 10 days, in which there are 2 or 3 vaginal scans just to see how the eggs are growing. And then 13th or 14th day of the cycle, usually the eggs are ready. So we give them a 5-minute anesthesia. It's just a short sedation. And with a needle, we just pick up the egg. So there's no actual surgery. There's no stitching, cutting, nothing. Just needle puncture in the 2 ovaries. A patient usually recovers within an hour and is free to go home in an hour or 2. 3 hours after the process, the lab will inform them that how many of these eggs are usable eggs.
Right.
So usable eggs are called M2s, metaphase 2s we call them. So as I told you, if they are under 35, we tell them that if you have more than 10, there is a 65% chance of pregnancy or IVF pregnancy in the future. If you have more than 20, then you have a 80-90% chance that you will conceive in the future. So age of the female is important. Number of eggs between 10 and 20 is important. Then we assure them that, okay, the eggs can be frozen for 10 years, 20 years, no problem. All the available international research is for 10 years, that people have used after 10 years and got the same results. So that is very reassuring for them, right?
Correct.
The bad statistic is that as of today, only 6% of girls in the world who have frozen their eggs have actually used them.
Oh.
So we are assuming that 40% will get pregnant naturally, because they are not infertile. Compared to our IVF patients, they have never tested their fertility.
Yes.
So obviously everybody is not infertile, right? So a lot of them may get married and within 2 months get pregnant naturally on their own and may never use their egg. So we say, okay, it's like your car insurance. If you have an accident, fine. Otherwise, you've just paid the premium. And we feel that maybe the other 50-55% are still in the process of settling down, finding partners, settling financially. And maybe we'll see a rush of them after 2-3 years, probably.
Also, I think the average age of marriage for a female has also gone up to about 32 to 36 years. Because
Yeah.
earlier they used to get married in their 20s. Today they get married late. So that is why I think this is like a preservation that they do to be on the safe side, to secure that kal ko agar if I'm not able to conceive in a normal way, so this is something which I will keep as a deposit.
Correct.
And whenever I need to use, maybe I can use it at that point of time.
Yeah.
So what are the kind of math when you talk about calculation costings get involved for a girl who wants to get her eggs
So it's similar to the IVF costing. It's almost like
Achha.
the entire IVF procedure except fertilizing the eggs. So it's almost the same. And then there is annual maintenance after the second year, which is minimal, just to keep the eggs frozen for a long time. So generally, it's within reach of most people.
Okay, wonderful.
The other, on a lighter note, today's generation. So I just had this patient last week. So it was really eye-opener for me, So she came for egg freezing with the husband. So I said, why are you freezing eggs? You should freeze embryos. You're married. Then when she was alone in the room, I said, no, I'm not sure I'm going to be with him. So I want to keep my options open. So you please don't say in front of him, but you freeze eggs, don't freeze embryos. So it was really heartening to see that, that how so well informed, and she's so clear in her mind about what she wants in the future. And she does, because see, if you make embryos and tomorrow, God forbid, there's a separation, she cannot use those embryos.
Right.
So she has lost her fertility in that messy divorce case, right? So a lot of them then opt for just doing egg freezing so that they are secure,
So thinking ahead of times, I think that's a smart way of
very, very
thinking. And
very smart.
absolutely. So with rising awareness of surrogacy, like we just discussed, what are the current laws of surrogacy if somebody actually wants to consider having a surrogate baby?
Yeah, so right now it's pretty difficult because we had the new Surrogacy Act, and it's a very strict act, right? And it was to prohibit a lot of malpractices which might have been happening in the past. A lot of exploitation was happening, a lot of bad things might have happened because of which laws do come into place. But as of now, of course, it's really strict. So a lot of clinics have just stopped doing surrogacy. Like we also didn't do any surrogacies for 2 years. And now, the couple has to get eligibility, essentiality from the local board, then the district board, the national board, surrogacy board. So it's a tedious process. And then we have to find a altruistic surrogate mother. Means it cannot be a commercial transaction.
Oh,
You have to find a altruistic mother, maybe a relative, may not be a relative, but she cannot take any money or, be paid any expenses.
no transactions.
Just her insurance cover or whatever other medical expenses and incidental expenses which might be there. So it's become pretty difficult and next to impossible because, how do you find a relative first of all? In today's busy world, it's very difficult to ask a sister or a sister-in-law to sacrifice 1 year of her life and do this for you, right? So it's become quite difficult, and let's see, we are hoping some amendments might come in the law and maybe there'll be some.
But in case if somebody finds a surrogate,
Yeah.
is there any right that a surrogate can exercise?
No, so then she has to do all her due diligence. She has to get her eligibility and essentiality. Then both the couple as well as the surrogate mother and the husband, they have to be in a court of law in front of a judge. And once all the documents, eligibility, essentiality, everything is scrutinized, he issues a parental order that everything is correctly in place legally, and now they can proceed with the surrogacy. So now we doctors are out of the picture. Once they come with a surrogate and come with the parental order, then only we do the process.
So there is a proper formal agreement.
Yes, formal huge contracts are there, everything is there. She has the right to terminate at any time if she doesn't want to continue.
Oh,
So all her rights have been preserved in the law, which is very good, which is excellent, of course.
correct.
She can change her mind anytime.
Absolutely. Doc, what about situations where a woman is menopausal and the male does not have any sperm count? What happens in that situation?
Yeah, so that, of course, it's very easy. Just pick up the phone and dial Wiki Donor. I'm
Oh.
sure all of you saw the movie. And it was a very good movie because it brought a lot of awareness to people. Of course, showing the same donor having 50, 60 babies is not a good thing, which is why we have the new laws now that one donor can donate only to one couple and so on. Yeah. So for the menopausal lady, of course, you need an egg donor. And egg donation is a very important component of our armamentarium, because it's not only the menopausal women, but you'll have a lot of women, say about the age of 38, who have failed 2-3 IVF cycles because of poor egg quality. Then we have girls who have never had a menstruation in their lives. They are called cases of premature ovarian failure, premature menopause. Then you have hypogonadotropic. There are a lot of such categories of medical ailments where the eggs are not good. So a lot of them will require egg donation. So now there is a good law in place where one egg donor can donate only to one couple. So, until 2 years ago, there was no law. which is why again you might have read in the papers that some donor in somewhere in the northeast had donated some 60 times, 70 times, yeah, and was totally exploited and things like that. So good, now there is a law that she can donate only once in her life, only to one couple, and also to prevent biodiversity being too much. Imagine if one donor has 200 children, they'll be all half siblings, and then they'll get attracted to each other and all kinds of chaos will happen in the world. So right now it's only one donor to one couple, and that's well regulated now. So a lot of categories of patients will require egg donation. So if you go to any IVF center, on an average, 20 to 30% of patients will require some form of third party support. So surrogacy is only 3 to 5%,
Right.
but 30 to 40% will require egg donation or sperm donation in the form of whatever the sperm donor, sperm bank, which all is now regulated, nicely done, and they are very successful treatments. So a lot of times you hear these miracles, 55-year-old got pregnant, 50 got pregnant, 45 got pregnant. So obviously those are all egg donation. Otherwise, it's not possible to get pregnant with your own eggs at 50. Right?
But tell me something, has it ever happened and there has been any mixing of sperms, eggs, jo bhi
That's our constant nightmare. Every morning I get up, every night I sleep, we always give it a thought for a fleeting moment. But fortunately, it doesn't happen. All good clinics will have two types of witnessing systems. So we have an electronic witness system where everything is barcoded, the dishes, the plates, the test tubes, the files, everything. And better than that, we have a manual witness system. So at any time in my lab, there will be at least 4 girls. Right. So if any one girl is dealing with one patient's eggs, there are 2 other girls witnessing what she is doing, whose sperm sample she picked up, what labeling has been done on the dish. So everything is not double but triple checked. So it's always very, very well done in most IVF centers because it's a bigger nightmare for us.
Yes.
A lot of times people think, हाँ ये डॉक्टर तो किसी का भी कुछ डाल देता है, IVF बच्चा अपना बच्चा नहीं होता है, एग किसी और का डाल देंगे, sperm किसी और का डाल देंगे. This loose talk is there everywhere, but patients have to understand that no ethical doctor would do that because today DNA testing is very easy.
Correct.
You don't even need a police case or an FIR. You just walk into a pathology laboratory and say, I want to match the DNA, and the doctor goes behind bars straight away for cheating and fraud. So we are more scared than the patients are scared. But of course, then on the other hand, you have these wonderful Bollywood movies, Good News and Bad News. I'm sure you saw all of them. So very interestingly, in both, they show these mix-up of babies and things. And of course, the people who suffer were us. Although my good friend Karan Johar made both the movies, but after Good News, I got phone calls from so many patients. Doctor, are you sure the baby is ours? Because they panic when they see what happened in the movie. But thankfully, it's all fiction. It doesn't really happen in real life, and no doctor would knowingly do such a thing because if he gets into trouble, you're losing 30 years of your hard work just for one patient. So I have nothing to gain and everything to lose. So that's very important.
The credibility goes for a toss.
So that's very, very important.
So, Doctor, you worked with so many families, thousands of families and celebrities as well. What was the most emotional experience or heart-touching moment in your practice so far?
Frankly, if you ask me, it's the same even after 32 years. 32 years, the kick I used to get when a patient used to get pregnant. Today, even if it's 4 per day, I get the same kick. Means that actually makes this one of the most gratifying and satisfying professions in the world. Because all other medical fields are about saving lives.
Right.
This is the only field where we are creating life. All others are treating one person. We are treating 2 people. So it's totally different concept. And that pleasure and the thrill and the happiness you see on their faces is today gives me the same satisfaction that I used to get right in the beginning. But one patient I really remember because she was one of the first of those types. Like every day in the newspaper you read, there was a drowning accident at Marway Beach. 3 schoolboys drowned. How much time do you remember that? 1 minute, 5 minutes, 10 minutes. A lot of those parents then come to IVF centers and they are all in their late 30s, early 40s or 50s also. If the kid who has been lost is of an elderly age group, right? And then we do IVF for them, and when they get a child again are some of the most real tear-jerking moments that we've had, So the first one we had, she came to me and said, I'm 42. And I had an only daughter, and she went with the Masa and her 2 cousin sisters to shop for saris. So she was engaged to get married. She went sari shopping to Mysore. So on the highway, they had an accident and all 5 passed away on the spot.
My God.
So this lady, she comes to me and she didn't say anything. She just took the photo of the daughter, put it on my table. Both husband, wife, only tears. And just telling me, we want her back. So now I said, I don't know what to do. And we started, it was just my 3rd or 4th year of practice. So I did 1 cycle, 2 cycles, 3 cycles, 4, 5, 6 cycles failed. 6 cycles of IVF failed. So I gave up. I said, now it's too late. It's not going to happen for you. Okay, no, doc, I'm not leaving your clinic till you don't bring her back into this world. So I said, okay, now what to do? So I did the 7th cycle, and luckily she conceived. And then she delivered a girl. The girl is now 27.
Oh my God.
And every Tyohar, my birthday, her birthday, every Diwali, Christmas, they are in the clinic. They are part of the clinic now. They are like family. In fact, she actually made me do the Kanyadan for the daughter also.
Oh wow.
We were that close, and she was amongst the first. After that, we did a lot of such cases, where really the human component and the emotional, means money is nothing then, Even if you have to treat them free, you just keep doing it because you just want her to get that child back. So the loss of that child now is the worst kind of cases that we see. And we've seen so many after that. We just lost count now,
I think, Doc, this must also be putting a lot of emotional burden on you, as a doctor.
Yes.
Because that's such a big responsibility that,
Yeah.
ये तो मुझे करना ही है.
Yeah, ये तो करना ही है. It's a challenge, ना, कि कैसे भी इसको pregnancy करना ही है. Then we had one more very interesting case. There were 3 sisters from Alibag. One was 50, one was 55, one was 60. And 2 were not married ever. And one was married, but she didn't have children. And she came to me at 60, the eldest one.
60?
60.
Oh my God.
So that was 30 years ago again. There were no laws at that time. And we were all in our youthful, okay, make any woman pregnant. We have the technology, use egg donor, sperm donor, whatever it is. She was ready for everything. And we did it, and she got pregnant. And that girl is also now 30. And she's also about to get married. And she's, I think, Maharashtra level badminton champion. And also she's very good at her studies.
Wow.
And then a lot of people in my clinic, my staff also told me, doctor, we did a wrong thing. Now she'll be 90 by the time.
I know.
At 90, she still visits me from Alibag once a year with the daughter.
Oh my God.
They see what you produce, see how she's become. Then she'll show me the medals, she'll show me everything. So these are now countless, we have. And these are the memorable patients, which we never forget, and they never forget us. So
I know. So how many such patients must be coming to you? Just because you did this procedure and
total, I've had successful almost 20,000 couples in 33 years. Because when I started, that time, rest of India didn't have clinics, only Mumbai had clinics. So when you asked about access, so that is the time when I started a lot of clinics all over India. So I started clinics in Agra, Madurai, Cochin, Erode, Pune, Chennai, and Bajitpur in Bangladesh. So all these clinics we started, and they were turnkey projects. So I would just go there 4 days, treat 50 patients for IVF in 4 days, and come back to Mumbai. So that is how technology went out everywhere, rather than patients having to travel to Mumbai and spend so much money.
That's amazing.
So that was the first kind of corporate chain, but I didn't have that much business sense to convert it into a chain. The minute I taught the local doctors how to do it, they were self-sufficient. I said, okay, goodbye. I'm back to my Mumbai clinic. That's all.
Excellent. So now we are in the world of AI.
Yeah.
So what's the role of AI, if there is any role of AI, to make this IVF process successful?
So like any new thing, it will have pros and cons. Like today, I think on InShots, you might have read first AI IVF baby born somewhere. I think China or Korea, I think. Yeah. So but the problem is that in India, everywhere, patients love these new things which come in. Like it was laser. Oh, you must go with this doctor. He replaces the joint with laser, or he treats the cataract with laser, or he does IVF with a laser. So it's very impressive, right? Patient doesn't even know what the laser is.
Right.
So AI is creating the same hype now. Right. So AI, as of today, we don't have any real application in IVF where it will help us improve results. It might for some new clinics. Suppose the embryologist doesn't know which sperm is the best sperm, or which embryo is the best embryo to transfer. Maybe AI would help them, right? But I still have my doubts about how effective it's going to be, how cost effective it is going to be. So I think we are 5 to 10 years away before it really makes an impact on our field. I still believe the human eye and the human hand is the best where these delicate procedures are concerned. And you've heard of these robotic surgeries being done nowadays. Surgeon is sitting in Delhi, patient is on the table in Bangalore. I mean, I get really scared how they do it, But so AI, yes, it will someday or the other come. But as of today, I don't see anything.
I think right now,
really
these kind of situations or critical things like IVF,
yeah,
human intervention, as of now, is a must.
Yeah. So it might help us to decide, okay, today is the right time to trigger the follicles, or maybe this is the best sperm out of these 10 sperms, or this is the best embryo out of 6 embryos. These are all the claims.
Correct.
By like our European Congress last year, half-day session on AI. All these things, AI for sperm, AI for embryo, AI for this, but it's all futuristic. Nothing concrete has come as yet.
Correct. Absolutely. So now, Doc, we come to the last question. This is breaking the mirror section. So according to you, what is the biggest myth about IVF that you would like to bust today?
There are plenty actually. Like, first of all, that it is not too successful. It's hugely expensive and it's a waste of time, money, energy, and doctors are out to fleece you. So I think that most people know now that it's not a myth anymore. IVF is very successful. If a patient, say 100 couples come to me and be with me for a year, we are reasonably sure that 80 out of 100 will get a baby, whether they do with their own eggs or donor sperm or a surrogate mother, whatever it is. If they avail of all the technologies, 80 to 90 out of 100 will definitely get a baby in 1 year.
True.
So this is not a myth. This is reality. We see it day in and day out. Number one. Number two, the cost is the lowest compared to all the Western countries and a lot of other countries in Southeast Asia also. Like even in Singapore, Bangkok, the cost is 2 or 3 times the Indian cost. So that's another big myth. And the third myth is, of course, that this is not my baby and the doctor must have mixed somebody's eggs and sperms and given you this child.
That's the most common myth which people...
Yeah, so that needs to be really clarified. As I already told you earlier, it's not easy to do. There are a lot of laws around third-party reproduction, a lot of consents to be taken. DNA matching is so easy. Paternity testing is so easy. So no ethical doctor would ever take a risk with that. The couple always knows what gametes are being used. And even the discharge reports we give, it always says eggs, wife's eggs, husband's sperm or donor sperm or whatever the case may be. So everything is very crystal clear, and it is not a 70 to 80% of IVFs have their own genetic offspring. It's only the 20-30% who might need one third party or both third parties. Again, like in surrogacy, you correctly said it's your own biological child.
Correct.
Only the womb, the woman is carrying the baby. So a lot of these misconceptions need to be cleared. For myths also, we can go on and on like it's too painful, there are too many oily injections, there's too much of bed rest. Now these are all things which were 10 years ago. So a lot of things have changed. IVF is very easy now. So generally,
I think people still have this mindset, and it will take time for people to, overcome these kind of mindset issues and, the kind of thought process the families come from. So I think over a period of time, people will understand the value and the importance of IVF, because sooner the better it is for them to realize that IVF is the way when you have to have babies, especially when you don't have age in your favor, or you don't have the right egg count, or you have a very stressful lifestyle. So many factors come into play when it comes to, considering IVF as an option. Thank you so much, Dr. Shah. This was a wonderful conversation and very, very informative, I would say. A lot of value addition has happened today, and I'm sure all the audience who will listen to this podcast will also have a huge takeaway from this, because we also know that undercurrent, there are so many people who actually want to find solution, but they are not able to. A lot of Google search happens. We also understand that, people think that Google is the next doctor and will give you all the solutions, but that does not actually happen, because you have the flip side of everything that is there. But this was straight from the horse's mouth, and I'm really glad that this conversation happened. It took place, and once again, I would say very, very grateful for you to be here and spend your time with us and give us so much of value and information. Thank you once again.
Thank you so much, Suman. It was really a pleasure. And I'm really privileged to be being part of your podcast. So only one last message for all the girls out there. I think, of course, they won't listen to me. That the first
Why will you not listen?
The first baby should be preferably out before 30. Second baby before 34. And if you don't have such plans, please freeze your eggs.
Yeah.
So I think that's the best take-home message I can give them.
Absolutely. And very, very important message. So thank you once again.
Thank you.
Yeah, pleasure. Today's episode gave us the front row seat into the real world of IVF. Beyond fear, beyond stigma, and into the realm of medical truth and emotional courage. Dr. Jatin Shah helped us understand the realities of egg freezing, IVF failures, donor conception, male infertility, and how lifestyle factors and AI infertility are shaping the future of reproductive health. If you found this valuable, do share it with anyone looking for IVF support, clarity on fertility options, or just the comfort of knowing they are not alone. Remember, IVF is not a last resort. It's a path backed by science and compassion. This is Perception and Beyond, where we bring forward the voices that matter and the truths that need to be heard. Subscribe, share, and stay tuned for more conversations that go deeper, than what's seen.